Hello, my name is Celine Braganini. I'm in group number 3, and we're going to be talking about LSD. First, we're going to be talking about how the drug can create a physical or psychological dependence or addiction on the drug. So, LSD is a strong mood and perception altering hallucinogen. It affects the person's thoughts, feelings, perceptions of their surroundings when they're on the drug. LSD is categorized as a Schedule 1 drug, so that means that it has no medical use whatsoever, but high potential abuse. But it is not proven to be addictive. LSD can make people feel good, blend their senses, see the world in new ways. Some advocates, from what I've read, believe it can quote unquote reset the brain or induce a powerful life changing hallucination and allow them to feel detached from reality. It can be a pleasant experience from what I've read, but just like any other drug, it does have its adverse effects and side effects. It doesn't have any physical dependency, however, but it does have physical side effects when the person is on the drug. But it does have a psychological dependency, and we will get into that. So for our physical addiction risks and symptoms, like I said, it has no physical dependency when the person is off the drug, but it does have some side effects while they're on it. So they can headache, dizziness, nausea can occur, anorexia. It's difficult for them to eat from what I've read. It increases blood pressure, increases heart rate, change in body temperature, dilated pupils, increased motor deep tendon reflexes, which is when one's automatic muscle reactions are extra strong or sensitive, muscle tension, ataxia, which means loss of balance. They have difficulty concentrating, they have dry mouth, they can feel unsteady, fatigued, and tachycardia. Like I said, there aren't any severe side effects, but if they do take too much LSD, it can lead to death due to convulsion, hyperthermia, and cardiovascular collapse. So like I said, it doesn't have any physical dependency. So that means if the person wants to take more of the drug to achieve what they felt before, they have to have a higher dose. So every time they increase their dose, that is what can lead to the psychological dependency. It can trigger long-term psychosis or schizophrenia if they take too much of the drug. Next, we're going to be talking about what LSD does to the brain and what neurotransmitters are affected. So LSD strongly binds to serotonin, dopamine, and adrenergic receptors. So the 5-HT2A receptor is a brain receptor that responds to serotonin and plays a key role in how we think and perceive the world, and that's the receptor that LSD and affects the most. It's also the main target of hallucination in LSD, which affects alertness, energy, and motivation. LSD changes the brain blood flow, electrical activity, and creates a brain that is more connected, meaning that various brain regions have more communication among them. Case studies have shown that the brain on LSD shows more activity and connection compared to brains without it. It's like the brain becomes more open and creative, but at the same time, the brain doesn't completely lose control or fall into chaos. It gets very close to that edge, very active, unpredictable, and creative, but it still keeps enough organization so that it doesn't quote unquote crash. Some people on LSD may even think that their mind has special powers and that they are connected to everything around them. Scientists think that these findings help explain why hallucinogens like LSD can sometimes help with depression. We're going to talk a little bit more about that in the next slide. When someone is depressed, their brain can get quote unquote stuck in or rigid, repetitive patterns of thinking. LSD seems to loosen up those patterns and make the brain more flexible, allowing new connections and ways of thinking to form. It also shows that every brain naturally balances between chaos and order. Too much order and we get stuck, too much chaos, things become confusing. LSD seems to temporarily push the brain closer to that balance point where it's more open and creative but still under control from what I've read. Next, we're going to be talking about the history of the drug. So LSD is an odorless substance that typically It's typically clear or white in color, and it's made from lysergic acid, a type of fungus found on grains such as rye. Um, it was found by a Swiss chemist who actually tried the drug for himself. In 1938, LSD was used as a therapeutic drug for depression, anxiety, addiction, and other psychosomatic diseases. It was initially manufactured, like I said, by a Swiss chemist. Then in the late 60s, LSD became a drug for recreational and spiritual purposes in an era called the psychedelic movement. It was banned then in 1967 due to its physical harm and concern regarding psychiatric complications. The decision about whether it is addictive or not is undecided, as I had mentioned in the first slide. It is banned all over the world, though, minus in some countries that still do testing on the drug. But like I said, it is a Schedule 1 drug, no medical use, high potential abuse. There were case studies explaining why hallucinogens are helpful in treating conditions like depression and offer proof of a basic principle of chaos and order that exists in all of our brains, whether it's on LSD or not. Next, we are going to be talking about street costs and name for LSD. So LSD is most commonly known as acid, or it can be referred to when ordering the drug off the street due to how you're ordering it and like how it comes. It can be referred to as a tab, microdot, or sugar cube. LSD prices can vary in the quantity it is bought in, the pureness of the drug, and location of where you buy it at. It can vary from $5 per gram to $200 per gram. You can purchase LSD as drops on a blotter paper. So I read that they put the acid, the LSD, they put droplets onto papers. These squares, called tabs, are placed under the tongue to get the desired effects, and LSD can also be placed in small tablets, gelatin, sugar cubes, and other edibles. So from $5 to $20 per single LSD tab, it can go from $2 to $10 per single LSD microdot, 80 to 100 micrograms. And then it can go from $15 to $30 per single LSD sugar cube. So that might be a little bit more might have a little bit more than the LSD microdot due to the pricing. And then it can also be bought in sheets that are simply a piece of paper acids that are soaked in acid, and you can buy it in bulk. Each sheet usually contains 100 squares or a tab. You can also get a full sheet with 900 tabs. So it'd be 500 to 1,000 for 100 tabs, or 2,500 to 6,000 for 900 tabs from what I've read. Next is going to be our works cited page, and then our last slide is going to be a fun little video I found on YouTube. It mostly talks about the history of the drug. It talks about that Swiss chemist and how he took it and what he experienced, and then it also talks about some testings that they've done with the drug on an elephant even, and I believe another chemist. So yeah, thank you so much.